Good evening, Shakolke. This is our first session of Doctors Meet, organized by SAMYA Foundation for Special Needs. It's a very memorable day for us today. কেননা আমরা অনেক দিন ধরে ডিসেবিলিটি ফ্যাসিলিটেটেড ক্লিনিক্যাল সার্ভিসেস তৈরি করার কথা আমাদের পরিকল্পনা চলছে, কিন্তু প্রত্যেকটা জিনিস তৈরি করার আগে তো একটা ফাউন্ডেশন লাগে। তো সকলকে, this is our first session of Doctors Meet. Okay.
Aditi, you can close your browser where YouTube is already open. That's why you are getting the noise.
All right. Thank you so much. আমি সেটাই বুঝতে পারছিলাম না। সরি, আমি একটুখানি দাঁড়ান, এখানে একটা কনফিউশন হয়েছে আমার। আমি ইউটিউবে আমার গলাটাই শুনতে পাচ্ছি। ইয়া, সরি অ্যাবাউট দিস। সো আমাদের এই সেশনটা আজকে ইটস বিং লাইভ স্ট্রিমড অন ইউটিউব। থ্যাংক ইউ ভেরি মাচ ভাবনা চাইল্ড ডেভেলপমেন্ট সেন্টার, মিস্টার অরুণাশিস অধিকারী, ডক্টর সুদেশনা চৌধুরী। আপনাদের সহযোগিতা এবং মানে এত বড় সাপোর্ট ছাড়া আমরা কিছুতেই এটা করা সম্ভব ছিল না। আপনাদের জুম স্পেস আপনারা দিয়েছেন, আপনাদের ইউটিউব স্পেসে আপনারা শেয়ার করছেন। Thank you very much for that. And today, while we start, we would like to keep this medium. We will discuss it mostly in English and also a little bit in Bangla. Already, Dr. Jashodhara Choudhury, who is quite well known as a very friendly and loving pediatric neurologist, is there with us today. Welcome to Doctor's Meet, Dr. Jashodhara, and I'm unmuting you for that purpose. And and also thanks to Dr. Sudeshna Choudhury. Dr. Sudeshna Choudhury, ma'am, if you could help me today in, presenting the screen.
Sure.
Thank you, Sudeshna, ma'am. And the rest of the audience will be kept muted. We have already noted down your questions. But before we start, since it's a very important day for us today, and today we have among us some of our advisory board members also. The president of our organization, Mr. Ashok Bandopadhyay. Dr. Sushma Nagarkar is there from Yash Charitable Trust, Mumbai. Thank you, Sushma, for being there. And we have got a wonderful message today from one of our advisory board members, Dr. Joyanto Roy, very well-known neurologist. Dr. Joyanto Roy could not be there today by himself. He could not be present by himself. So he has sent a video message. And I would request Dr. Choudhury if you could share the screen and play the message, and then we get into the Doctors Meet program directly.
Yeah, I'm sharing it. Okay.
Good evening. I am Dr. Joyanto Rai. I am Director of Stroke Program and the Senior Consultant at Institute of Neuroscience. Today, SAMYA Foundation is organizing this very important program, and I congratulate Dr. Aditi Bandopadhyay for organizing this program because she has chosen a very useful topic of seizures in special needs children. And Dr. Jashodhara Choudhury will be talking on this subject, who is also an expert in this field, and I hope this program will be a very useful one and a big success. Thank you very much. Good evening.
Sound শোনা যাচ্ছে।
তুমি একটু নিজেকে আনমিউট করো অদিতি, ডক্টর অদিতি।
Yes. Sorry about it. Yeah. So now we get directly into the program. We can see that our audience, they are joining. We have restricted the Zoom space for only members of SAMYA Foundation, but those who are viewing it, who are not a part of SAMYA as members, they are viewing it directly on YouTube, and the program will be archived on YouTube as well. So I directly get into the program. Since I see a lot of, and we also have our advisory board member, Dr. Jemsi Jose, with us. We are so happy today that we have our advisory board members, Dr. Jemsi Jose, pediatrician, who has been always supporting us. We have Dr. Jayanto Bhattacharya, who was there in our telemedicine helpline with us during the COVID crisis. We have Dr. Sushma Nagarkar, and we have all the wonderful parents that have made this program a success, who had been continuously asking me to do this program on Caesar, because, and that's why I'm keeping our discussion today mostly based on English, because I see a lot of out of town people who have joined from Bangalore and Mumbai. So Dr. Jashodhara Chaudhary, we initially decided we will keep it in Bengali, but we might choose to keep it in English, keeping in mind so that all the audience realize it. So I'm going directly into the questions. Myself also, as a parent of a child on the spectrum, having on the autism spectrum, and also I have been working with a lot of parents for the last few years. Caesar is something which becomes a household name for all of us. We start realizing convulsion, about it we all have heard before, but then we all get to understand that what is Caesar. And then again, if you could explain to the parents, to all the people here, that what actually is Caesar জিনিসটা কি, আর Caesar যখন হয়, how do you identify that my child is having a Caesar? Because parents nowadays are hooked up on names. They come and tell me my child has myoclonic Caesar, or my child has got tonic-clonic Caesar. And as doctors, we understand that there are the nomenclature and the classifications are big. But what do parents actually need to know? That what is Caesar? How do I identify a Caesar? If you could shed some light on that.
First of all, a very good evening to all of you, and thanks to Aditi Di for arranging such a wonderful gathering. And today we will be having a discussion about a very serious topic, but we will keep it quite impromptu, and the parents already have given their questions, and anybody is free to ask anything in the chat box.
Yes,
So,
I would like to mention, sorry
Hmm.
to interrupt you once. If
Yeah.
anybody wants to post any question, kindly post your question in the chat box. We will go over it at the end
Yeah.
of all the questions.
Yeah, sure.
Yeah.
So, Aditi, as you were asking, what is Caesar? Caesar, as we know, I am not going into the difficult medical terms because
Right.
it will not be very useful for the parents. So, what the parents need to know, it's kind of an electric discharge that goes inside the brain that is caused by something called neurons inside the brain. There are many medical terms defining seizures, but we have to pick up when the child is having seizure, whether at all this is a seizure, because we have something called pseudo seizure or seizure mimics. সিজারের মতো দেখতে হয় কিন্তু আসলে that is not a seizure. So that is very important to pick up. For example, আমি একটা কথা বলছি, very frequently children, especially in the age group of 4 years, 4 to 6 years, wake up from night, shout at night, and they are very frightened. That is a very close seizure mimic. So when will a parent know whether the child is having actual seizure or is it just a nightmare or a night terror? So it is very important. Usually, when a child is having seizure, you will notice that there is something odd regarding the child at that time. The child, there will be an abrupt onset. The child is playing or doing something, whatever he does. In one moment, the next moment he goes something, he is doing something very odd or something he's not in himself. So there is an abrupt change of behavior. If the seizure is like generalized tonic-clonic seizures, like there are movements of all four limbs, head movements, then it is very easy to understand that the seizure is going on. But there are some seizures which are very subtle. For example, absence seizure. By now, I think the parents may know this term. Many parents will know this term because absence seizure is very mistaken with some features in autism also. So I think you have to understand there is something abrupt change in behavior of the child, and it may be accompanied by tongue bite or maybe urinary incontinence. So if a parent notices that the child is having some abrupt change in behavior along with urinary incontinence or any looking at one direction persistently, then then the parent should understand that something is wrong with the child. This is not a normal phenomenon. So, and if the child is moving the limbs, there is shaking of the limbs, then it's obvious. But I'm talking about the less obvious things. So the abrupt behavior, looking in one direction continuously, persistently, and if there is urinary incontinence, হঠাৎ করে বাচ্চাটার নিজে থেকে ইউরিন পাস করে দিল, একদিকে ক্রমাগত তাকিয়ে আছে, স্পেশালি একটা কোণায়। অটিজম আমরা অনেক সময় দেখি দে প্রেফার টু লুক উইথ দ্য কর্নার অফ দ্য আইস, but you see they're moving their eyes, but when the child is having seizures ও কিন্তু ফিক্সড হয়ে থাকবে, একটা দিকে ফিক্সড হয়ে থাকবে। So the parent must notice that যে চোখটা কিরকম ভাবে মুভ করছে। So that is one of the important things.
Thank you, Jashodhara. That is actually very helpful. There are many parents here who actually their children have started having seizures, or they are having seizures from early childhood. So they are accustomed with what is a seizure. But then parents whose children have not yet gone through a seizure, but they are always very apprehensive that my child might land up with seizure. Right. So that day I was discussing with you when you said that there are seizure peaks in infancy, in puberty.
Exactly.
Just as my child is entering into adolescence, I am always very scared that a seizure might precipitate any time, because that is a feature of autism. So what would you say about this? To be very careful during these ages.
Yes. Actually, autism, as we know, if you search in Google, you'll find that there are two peaks, one in infancy, one in adolescence. In infancy, it is very clear if there are seizures, then it is picked up easily because there are frank signs. In adolescence, what happens that what causes seizures, like there are hormonal changes. Usually in the girls, it begins a little earlier. In the boys, it begins after usually 11. So what to notice and what are the precautions? These are the two very important points that parents should know. So what to notice? Because adolescents may throw tantrums, they may keep quiet for a long time, even in autism. Even if the child is non-verbal, then also he may show behavioral tantrums, behavioral changes. But if you again see what kind of seizures are more frequently seen in adolescents, one is a myoclonic seizure, juvenile myoclonic epilepsy. What will you see? It occurs in early morning. If you notice that your adolescent is having, recurrently in the early morning, is dropping his toothbrush, is dropping his spoon from the hand, is dropping his milk glass from his hand, you should be very careful, very, very extremely careful, because that is the first subtle sign of juvenile myoclonic epilepsy. Second one, there is another one that may occur in adolescence, that is called juvenile absence epilepsy. এটা আবার চাইল্ডহুডের থেকে একটু আলাদা হয়। দেখবেন অনেক সময় অ্যাডোলেসেন্ট হয়তো ভাবুক, আপনারা সবাই বলে, আমরাও ক্লাসে করতাম, অন্যদিকে তাকিয়ে আছি, we are looking through the window, we are doing that, but neurotypicals also do that. But if the child is looking through the window, then the teacher scolds him, what are you doing? The child quickly comes back to the real world, but what he was doing at the moment, a neurotypical child will be able to tell. Even a neurodiverse child will be able to express what he was thinking. But if he is having a seizure, he will have no memory of what he was doing. Even if he was doing something strange, even if he was picking at his hairs or anything, he will have absolute no memory. He will be blank about that episode, about that staring episode. So a parent or a teacher should be very careful. If the child is staring out of anything, window or anything, the child is staring or getting অমনোযোগী যেটা বলে ক্লাসে very frequently হয়ে যাচ্ছে বা একদিকে তাকিয়ে আছে, then we should think once whether this child is having epilepsy or is it just a symptom of autism. We should be very careful. আর একটা হচ্ছে মায়োক্লনিক, হচ্ছে এগুলো হচ্ছে জুভেনাইল অ্যাডোলেসেন্টে বেশি হচ্ছে। And partial seizure you can always get, because আমরা অনেক সময় কি দিই, আমরা অটিজমের ডায়েট করতে হবে, we are giving fruits, we are giving salads. তো হয়তো বাচ্চার এনসিসি হয়ে আছে, neurotypicals can very clearly say we are having headache, we are having this, we are having this, but many people with autism won't be able to express. They may get cranky, they may throw tantrums, so you may miss the earlier signs. So focal seizures may happen at any time in adolescence. So focal seizures is very obvious. There will be staring at one direction. It is quite obvious. It can be picked up by anyone. So these are a few common types that we see in adolescents. But we should not miss the myoclonic epilepsy, because it responds excellently to medicine. And if it is not treated in the proper time, this may be very dangerous. And another very important thing that may happen, that is called the eyelid myoclonus. Once the child is doing like this, blinking very frequently, in adolescence. Mine was in adolescence, the child is blinking like that. Then the child is stimulating himself, like he's putting his hand on his eyelids and force blinking, or in light he's blinking. This is not a tic. This is not an autism syndrome. If he's doing that recurrently, that is called a Gibbon syndrome. That is a type of epilepsy response to medication. So these are some types.
May I just interrupt you for
Yeah.
a second? Because, here I'm sure among the audience, we have another advisory board member, Rashmi Mantri ma'am, who has spoken earlier also in our
Yeah,
building session. And she deals with a lot of children. And there are also other special educators, as I said, Dr.
Yeah.
They school psychologists, they all know that in autism, we see this very frequently, right? Blinking eyes, pressing
Yeah.
eyelids, and we say that they are also self-stimulating themselves.
Mm-hmm.
They're looking at the light, they want to get the see double vision, and they like that they look at the movements of those rotational bodies like fans.
Exactly.
So then in such situations, how do parents identify? Because by the time a child reaches adolescence, we get into the habit of understanding that there are severe behavioral issues, sensory processing disorders. At that moment, how does a parent differentiate? No, this is also can be a flag sign for a seizure.
Yes, I'm telling you some that it may sound unfortunate, it may be sounding strange. Even in our most difficult epilepsy books, like only for epilepsy, we have several textbooks. This is given as eyelid myoclonus. Nowhere they have said that this can be a sign of autism. You think the situation, like people are not even thinking of these individuals because they have these overlapping syndromes, because they are not associating these two things together. So this may be a sign of tic. We all know that tics may come at age of 5 years or so, and one kind of tics may come later, especially in the adolescents, like shoulder shrugging, eye blinking. That is very commonly seen in autism also. So,
sorry to interrupting you, but many a times, even if they're asked to do something, not only in autism, also in different kinds of behavioral challenges, we see they close the eyes suddenly. They will close the eyes, and also many a times they will try to do things. Okay, that I understand. If they're trying to do some things, following instructions, closing the eyes, they are aware. But at times they will just become still, closing the eyes with rigid hands. হাত পা স্টিফ করে দাঁড়িয়ে পড়লো, চোখ বন্ধ করে, and then after some time it's okay.
এটা আমি বলছি, এটা হ্যাঁ, সিজারের কি হয়, জিবন্স যেটা হয়, জিবন্স ইজ হাইলি ফটোসেনসিটিভ। অটিজমেও হতে পারে যে আমি আলো দেখলে চোখ বন্ধ করে দিচ্ছি, বাট the Gibbon syndrome, the seizure, it is triggered by light. It is triggered by light. And
Gibbon syndrome.
G-E-V-O-N, or it is called the eyelid myoclonus absence. That's a big name. But it is not uncommon, as we see, because while seeing patients, I have seen few patients who are having this. They did not have autism, but autism parents, it's very difficult to differentiate, because only that they may not have come to us because they think that it is a tic. Because the thing is that they're repeatedly blinking, and what they do in Gibbons, they have this habit. After doing that, they get some relief. So they put their fingers into their eyes. So it's very difficult. But in Gibbons, one thing is that in EEG, we get discharges. So that is a very differentiating point.
What discharge they will get? Sorry?
In EEG, electroencephalography, in Gibbons syndrome, we get usually discharges. So that may differentiate.
So EEG, so in that, for a parent,
if the neurologist thinks that EEG should be done.
So the parent should be aware that this
should be very much so, because it can be treated.
Okay. So actually here, before I move on to the next question, which is related to the topic that we had discussed, and just now you also mentioned that it is hard to differentiate at times between tics and seizure. As you mentioned, mentioned about Rett syndrome, which females have. And there also you said that in Rett syndrome are difficult because in our organization, SAMYA, we have some 2 of the adolescent girls who are having Rett syndrome. And for them also, we see a lot of facial tics. So I'm not sure one of the parents is here today. So do you think for them also that they should go to a pediatric neurologist or refer at least to a doctor and find it out?
Definitely so. I'm telling about Rett syndrome because I've worked with a Rett syndrome group also. So Rett syndrome is something very different, because what happened, then their electroencephalogram, the EEG, never matures like an adult. Okay, but that is not an abnormality. That is the syndrome they have. So, but they are treated on basis of that. Even if they don't need anti-epileptics, many times it's given, because in adult neurology books it's not written like that. So, their EEG, the electroencephalogram that doctors see, it never matures like us. That will be always of 5 years, 6 years of age. So that will be something not normal, but it should not be treated. Also, they do something, Rett syndrome especially, they have this, they hyperventilate a lot. That also many neurodiverse children do. And they stop breathing also. Like this kind of, they take a deep breath and then suddenly stop. This may also people think that, মানে হঠাৎ করে নিঃশ্বাস নিয়ে বন্ধ করে দাঁড়িয়ে থাকলো। তো ওটাতে প্যারেন্টসটা অনেক সময় ভয় পেয়ে যায়, যে think that the child is having seizure. Actually, the child is not having seizure. Rett syndrome especially, they have some autonomic dysfunction. ওদের রেসপিরেটরি সাইকেলটা একটু গন্ডগোল থাকে, স্পেশালি ওদের নাইটে খুব ডিস্টারবেন্স হয়, অনেক সময় হয়, মানে বেশিরভাগ ক্ষেত্রে হয়। তো ওইগুলো সিজার হিসেবে ট্রিট করা উচিত না, কারণ ওদের ক্ষেত্রে ওগুলো কি হয় যে প্যারেন্টসরাও ভাবছে সিজার, ডাক্তারও ভাবছে সিজার, অনেক অনেক অ্যান্টি এপিলেপটিক খায়, আলটিমেটলি ওগুলো ওদের কগনিশন কমিয়ে দেয়। তো দ্যাট শুড বি they should always visit a neurologist or pediatric neurologist, should clarify whether the child is actually having seizures or taking the medicines uselessly. That is the most important thing in Rett syndrome, because they will always have some diagnostic problems and always have some symptoms that will mimic seizures closely. মানে একদম মনে হবে সিজার হচ্ছে, আসলে ওটা হচ্ছে না, ওটা ওর অটোনমিক ডিস্টারবেন্স।
Okay.
তার অন্য ট্রিটমেন্ট আছে, নট অ্যান্টি এপিলেপটিক।
Even it is hard for doctors to figure it out, differentiate, like a
ভেরি
doctor.
ডিফিকাল্ট, বিকজ পেরেন্ট এসে বলবেই, এবং আমি ধরুন বললাম যে আমি শান্ত করলাম, কিন্তু আরেকজনের কাছে হয়তো উনি যাবেন, উনি ওনার দেখে ওটা মনেই হতে পারে সিজার, তখন দ্য প্যারেন্ট উইল গেট কনফিউজড। বাট এটা রেট সিন্ড্রোমেই আছে যে ওটা কিন্তু অটোনমিক ডিসফাংশন হয়, সেটা মানে দেখার সিস্টেমও অনেক ডিফিকাল্ট, ফ্লোমেট্রি করা, সে তো ইজ ভেরি হার্ড টু ডিফারেন্সিয়েট।
It's actually nice today. Just before going to the next question, I would like to mention we have Dr. Anirban Pal, Dr. Nandini Rai, Dr. Urundhati Balgordhan. They are all in our telemedicine health.
Okay, that's so
As I
nice.
mentioned also about few clinicians before, and they have all joined. So we are all hugely benefiting and also learning, and we
Thank
can
you so
share
much.
also.
Yeah,
Please
yeah.
send more questions to the chat box. From this, I am directly going to the question asked by some of the parents. Which I have forwarded to you. Some of the questions might overlap, and to all parents here also, I am saying on behalf of Dr. Jashodhara Chaudhary that you have mentioned about the drugs and their dosages, but since they have been prescribed by your respective neurologists or physicians, we would not comment here anything about the drug dosage or the regime. But yes, of course, we can give you a general answer. As much as possible, we will try to help you. Because that is because Dr. Chaudhary hasn't seen your child, and so we cannot comment on this platform. Exactly. So this question comes about little Arya. Arya, I know, who had been having seizure. This year she developed seizure. The whole family had gone through crises of different kinds. They had a wonderful blessing as a baby boy came into the family, and the family also was COVID positive. Lot of things happened. Little Arya developed seizures. So since September, she's on Levipil. That I'm mentioning the drug only. And sometimes her mother says she's a little aggressive, and sometimes she's drowsy. She doesn't know if these are the side effects of the drugs. And she also doesn't know how long to continue with the drug, which of course the pediatrician or the neurologist can say. But she's saying that Arya has started making some strange noises. Can making these strange noises be a side effect of these drugs? And at the same time, she wants to know, Arya had generalized tonic-clonic seizure. She has learned the name from the physician who has given the diagnosis. She said that what is the overall prognosis? She has a lot of questions, and what is the overall prognosis? And naturally, as a mother, she also wants to know that would have keeping the child on a keto diet help to prevent seizures? And in case of fever, what can be as a she can use as a prophylaxis, as a precaution to arrest the seizure? Because most of the times she had febrile seizures, but she has a diagnosis of generalized tonic-clonic seizure also. And Arya, I think, is 6 to 7 years old. She's
Okay, so number one, I'd like to say to her that first question was Levy pill can have some behavioral side effects. If you go through a simple Google search, you'll see. But also Levy pill is a drug that can be used for any kind of seizures. That is a broad spectrum drug. মানে broad spectrum মানে ওটা অনেক ধরনের seizure কে cover করে। So Levipil is a pretty safe drug. Few persons, both children and adult persons, may have some behavioral effects. Behavioral effects in the sense, many persons may get aggressive. কেউ কেউ আবার depressive episodes এ চলে যায়, but that is a side effect of the drug. That may be a side effect of the drug. I'm not saying all the persons will have that. So if you are suspecting that you are having too much side effects because of that drug, you can request your physician to change it, or you can report to your physician. Number two, she said that the child prognosis of the disease, that depends on the neurological status of the child, the MRI findings. If there is some lesion in MRI, then the prognosis may be, the drugs may be required to continue for long. If the MRI is clean, if the EEG is clean, and if the child is having neurologically intact, meaning that I'm not saying about autism per se, neurologically intact means the neurological examination is intact, then if the child is seizure free for 2 years, then the drug may be tapered if all these criteria are fulfilled. And long-term prognosis without seeing the child is not possible to predict. Third thing is that some of the anti-epileptics are not particularly suitable for girls, especially for girls who are going to reach adolescence soon. So in that case, a doctor has limited options in his hand. So that in that case, Levipil is pretty safe for girls. It can does not hinder the adolescence, pubertal changes, or pregnancy later on. So it's a safe drug for girls, but some behavioral changes may arise. For her last question, I think, was ketogenic diet. Ketogenic diet is reserved for refractory seizures which are not responding to anti-epileptic medicines. Ketogenic diet is a fancy diet. It is not tolerated by children at all. Please don't try or even think of it without any expert's guidance, because it is very unpalatable. আপনাকে দিলেও আপনি খেতে পারবেন না, and it causes very serious side effects if not used appropriately. So don't even think. We have to think in such cases who are having refractory seizures despite 4-5 medications. So in this case, it is not advisable. But because the child was having febrile seizures and then afebrile seizures, we have to see one genetic mutation that is called the SCN1A mutation, because that has got a separate medication. So that is the thing.
Explain refractory seizure in very briefly to.
Refractory seizure হচ্ছে দুটো anti-epileptic. If the child is on at least 2 anti-epileptic in proper dose, মানে dose according to his or her weight, এবং সে কমপ্লায়েন্স ঠিক আছে, মা বাবা ঠিক টাইমে ওষুধটা খাওয়াচ্ছে, তাও তার সিজার কন্ট্রোল হচ্ছে না, তার সপ্তাহে 2 বারের বেশি সিজার হয়ে যাচ্ছে, then it is called refractory seizure. And appropriate anti-epileptic মানে আমি বলছি, মানে ফোকাল সিজারের জন্য ফোকাল সিজারের ড্রাগই খাচ্ছে, জিটিসিএস এর ড্রাগ খাচ্ছে না, মানে যেই সিজার টাইপ তার জন্য সে রেকমেন্ডেড ড্রাগ, মানে আইএলই এই রেকমেন্ডেড ড্রাগ খাচ্ছে, অন্য ড্রাগ খেয়ে কন্ট্রোল হচ্ছে না, that does not make any sense. That is not refractory.
So for a non-medical person, it should be like that refractory seizure is when the child is on multiple anti-epileptic drugs and which are meant for different kind of seizures, because a non-medical parent would not understand that. But in that situation, best is to talk to the pediatric neurologist and then or go for a keto diet, not to do it on their own. Because I have very recently, there was a child with a head injury and the parent were definitely in a very big trauma. But then, you know, other parents were discussing how could he have seizure? He was on a keto diet for so long. And you know, it's a very fancy diet and a very fancy term these days. Use it for weight loss, people use it for so many.
keto diet একদমই মানে ঝাঁপিয়ে পড়ার কোনো রিজন নেই, সব এপিলেপসিতে কাজ করে না। The funny thing is that keto diet is detrimental for few epilepsies. খারাপ হয়ে যায়, তাদের বেশি সিজার হয়, তাদের কগনিটিভ ডিক্লাইন হয়, তাই জন্য সব ক্ষেত্রে তো ইউজ করাই যাবে না। আমরা একটা বিশাল চেকলিস্ট আছে, ওগুলো রুল আউট করা হয়, তারপরে কিটোজেনিক দেওয়া হয়।
Okay, thank you so much. I move on to the next question. This is by a mother of a 7-year-old boy, and who has been again on another anticonvulsant drug valproate 200 milligram for last 4.5 years, and the EEG, CT scan, MRI, they show no abnormality. So the child keeps facing absent seizure. So the mother thinks that now that the child is on valproate, again, as I say, we are not going to comment on drugs and its usage, but she says that if my child is on valproate for so long, is there a chance of developing behavioral issues as a side effect? And with this, may I also add this question, because we in our organization, we have a lot of children who are on valproate for a long time. I don't want to scare parents, but it's because this is a parents forum. I am also discussing here more as a parent than as a physician. I have very recently, we lost a child last year due to acute pancreatitis. It was a very sad thing. And then even the pediatrician said that it was not that the child should not have been on valproate for a long time, but it said that the onset of acute pancreatitis, which claimed the life of the child, was probably due to that. So, with valproate, we have a lot of questions in our mind, even being doctor parents. So
she is having absent seizure. The absent seizure niye ekta there was a very good trial in Lancet. Ami parents er jonno banglatei bolchi, tate 3 drugs were evaluated.
Mentioning here to parents, yeah.
Oh, okay. You want in English, right? So there were 3 drugs.
Some out of Kolkata people here, I see. So
okay, fine. Yeah. So English is fine for all, right?
Yes,
okay.
Yes.
So there were 3 drugs for absence seizure particularly. One was valproate, one was lamotrigine, and third one was ethosuximide. So they showed that valproate and ethosuximide, they were good in controlling the seizures. But in long term, the people who were on ethosuximide scored better cognitively. Okay. So this ethosuximide drug was till 2 years back not available in India. But now it is available in India and in Kolkata. But the issue is the price is more than valproate. Okay. So if the parent can afford, and if there is no such issues, then they can request the physician to change valproate to ethosuximide if the child is definitely having absent seizure. So that is one thing, because her issue is cognitive decline. So it is now available. So change is possible.
Okay. So change, and then again, those who are on valproate for a lot of reasons, should they get their dose revised every now and then? Is it something drug like
one
that?
Thing, before giving valproate is a broad spectrum drug. Like I said, that it covers a lot of epilepsies. It's a good drug. But the issue with valproate is that it causes some toxicities. Toxicities were one in liver, one in kidney, some bone toxicity, and some cognition. So, and obesity. Valproate causes obesity, and in girls, it causes something called PCOS and later infertility. These are the side effects. But valproate is good in controlling seizures. So, what can we do? We can rule out, at least I do, so that some conditions in where valproate may lead to very severe outcomes. Like if the child is having some metabolic disease, if you are giving valproate, then the child may go in coma. So few conditions should always be ruled out before giving valproate. So, and also we do a SGOT, SGPT in 3 months or 6 months interval to see whether the valproate is causing any hepatotoxicity. So that is another thing. Liver toxicity, it causes valproate.
Monitoring, parents should be aware. So parents are asking good questions, that they are not worried about.
This is a very relevant question. This is a very relevant question, because we see valproate toxicities. We see valproate toxicities, and we have to omit that drug for toxicity often.
Okay, so I move on to the next question. This is about a darling child of ours, Ayushi, 15 years old. And she's on a lot of drugs. She's having myoclonic epilepsy, and she's on a lot of drugs for the past 4 to 5 years. Valperine and Levipil, Lobazam, Lacosam. So, and twice daily. And I have seen Ayushi myself. She would have seizures every now and then. She would stand up, she would just immediately fall, have a seizure, and then again gather herself and get up again. So, and then she also has a lot of other health issues. And this child has really been trying to do well for a long time. But her mother's questions are that, can these medicines cause behavioral issues in her in future, though she's in her adolescence and her mother keeps complaining she doesn't listen to her, and I don't think it's the contribution of anti-epileptics, but she says that Ayushi has body disbalance, shivering of hands, learning disability, and she wants to know that what is the solution, that if is it going to hamper her growing up in any way. And she had the same question regarding keto diet, which you have already answered.
So one thing you were saying, Arushi is falling down. I'd like to ask Arushi's mother later on whether how is she falling? Because if she is falling on the hips or if she is falling forwards, because there are now it has been discovered that
1 minute, I'll just unmute her, because I have seen Ayushi falling. She fell not on the back, but still I think Ayushi's mother is here, and
if she
I
is
will
having
just,
drop attacks, like the head drops are going on. If the head drops are going on, then to control that, she has three options. One is clobazam. She is already on clobazam, I think, so that the dose can be increased. One is a drug called rufinamide, which is not in use here very much. And the third one is a surgical option, which is right now not an option for her, I think. If she wants, she can go for that evaluation also. Third thing, if she's falling on the, like she's having frequent head drops, for head drops, I suggested those things. And she needs a re-evaluation of the regime if her mother has so many concerns. And if she's on so many anti-epileptics, some behavioral issues may arise. I won't give any false hopes to her, because some behavioral issues may arise, especially with high dose levetiracetam, it may arise. But if she is having severe behavioral issues, then only we need to reconsider that levetiracetam part, because it acts well in myoclonic seizures. And the other drugs obviously needs to be evaluated if she is having so frequent seizures.
okay. Okay, and regarding this body disbalance that she has been asking.
Yeah, that was I was asking, how is she falling? She is falling on the buttocks or she is falling on the knees, because these two have different implications. If she is falling on the buttocks, that is an myoclonic atonic seizure. If she is falling on the knees, that is a different kind of seizures. If she is having only head drops, that is head drop attacks. So if she has videos, then she can later show or something like that.
Okay.
Because these three have different implications for drug selection also.
All right. I can't find among so many people. So maybe if Ayushi's mother is here,
if she is listening, then I think she will better understand.
Yes. And so next I go to this question. I'm not sure if this is a question appropriately placed for this forum, but this is again about a 22-year-old girl who comes to our center, and Ritu, and she was very disturbed during this lockdown phase, and she could not accept and I have posted the question to you, unusual condition, she could not accept it and started different behavioral issues. So mostly she has been given here, I see, on an SOS basis, Zappies and then Nexito, and her sleep developed well. But well, her parents were very bothered to kind of trying to understand that whether this kind of depressive phase in the lockdown giving rise to a lot of behavioral issues, because many a times she's an autistic person, and many a times in autism these are you are unable to figure out whether this can trigger a seizure or not. So do you think such depression?
No, I don't think any kind of this behavioral issues will trigger a seizure. If she is having seizure, then she is having seizures. Her parents have to take some videos of the things which they suspect to be seizures and then show that to a doctor. And for night sleep, is it okay now? If it is not okay for autism children, for children, she's having Nexito contains escitalopram, that is an adult drug. She's an adult, she can take that, but we prescribe melatonin that gives more of a natural sleep than any kind of outside medication. For me, for example, I don't prefer strong medications. I go with the lighter ones initially. So I think melatonin, we normal people secrete that from our brain at night time to let us into sleep. And for autism also, who have severe sleep problems, severe ones, before giving any kind of drug, I ask them to do many kind of maneuvers, as we all know, for sleep and autism, like proprioceptive and many other things. if all of those fail, then only medication
But
should
the
be
parent
used.
is writing that she does not have any problem with sleep. This is, I'm
Okay.
reading out the question again. She was very disturbed throughout the lockdown phase, could not accept the unusual condition. She's 24 years old, and she was given Zappies 0.25 on its SOS basis, and the medicine frequency was increasing with increasing behavioral issues. Finally, she was prescribed Nexito 10 milligram, and she has been taking this since 16 September. Issues are almost 90% overcome. So should they stop the drug on their own?
No, they should not do that. And first they have to find out why if the child is communicating, the girl is communicating in any way, they should find out what is triggering the behavioral issues. If she is having some internal problems, like if she's saying that she's having some problem in the head, she's having some uncanny feelings, uneasy situations, then they should talk to the doctor and just then go for it. And if it is only due to the lockdown, only due to the environment, then it is okay. But once they should consult a doctor, because abrupt tapering of any medicine, any kind of medicine, is not good.
Okay. Okay. Here we find a wonderful question placed by Rashmi Mantri, ma'am, who's also in our advisory board, as I said, because she's handling a big group of children with special needs in schools. She's the head of the Department of Special Education in APJ group of schools. That if a child shows symptoms of seizure in school environment, then what are the immediate steps that need to be taken, which can be like first aid and can be performed by any adult or teacher or any attendant? I think it's a very practical question.
Yeah. So when a child is having seizure suddenly in any environment, school, in tuition, in a home, any place, so you first let the child lie down, put him to one side, left lateral side. We have to turn the child to his left and make him stay in that way. Loosen his clothes, especially if it's wearing the collar, buttons are tied up, loosen the clothes. Don't insert anything inside the mouth. That is something which is done often. Any spoon or something is inserted, that should not be done. And don't make the child sniff anything, any bad thing. Many persons hold the shoes and something to bring into senses. Don't throw buckets of water on the child, because what will happen, the child will intake some water and then aspirate. Don't do that. Just let the child lie on the left lateral side and then loosen the clothes. If the child is having such seizures, if the parent has informed, then the child should carry a midacid nasal spray or midazolam nasal spray as an SOS medicine.
Schools also keep it as a safety measure in the first.
I don't think they can't keep, because it is quite expensive and it does not have a long lifeline. The expiry date is short, so it's not possible for the school. And if you use for one child in this corona environment inside the nose, how can you use for the others? It is not possible, right? So if the child is having a history of seizure, the parent should supply that. It will be much more hygienic, much more clearer, and the instructions should be given. Should be written actually on the child that this child is having seizures. If he is having sudden seizures, then puffs of 2 puffs or 3 puffs should be given in the nostril, and then if the seizure is not ceasing, then the doctor should be called, something like this. This is the basic first aid. Because what we do, no, I'm not asking the schools to keep. What I said, the parents will have to supply, or parents will have to give to the teacher. Again, in case of adolescents, this cannot be given with the child. Why? Because this has some abusive power. So it cannot be given to the child in case of adolescents. So if the child is known to have seizures, the parents can communicate with the respective school teacher and give a supply to that. Schools cannot keep that. And this is not invasive actually. This is a spray. Like in headaches, we have the Zolmi spray. This is a spray that madam is asking that this is an invasive medicine. This is not an invasive medicine. That is a plain and simple spray. Like for headache, we have Zolmi sprays or something like that. It is a spray in the nostril. That is not invasive. No injection, nothing is required.
So the child can very well carry it to the school, and that will be helpful. So here parents also
the child carrying, there may come up issues, because if the child sprays or something like that, there are abusive potentials in these drugs.
So they can
So this
keep
is a tricky.
with the special.
This is a tricky thing. What can happen? The parents can directly give to the school. My child has seizure. The child may have seizure. So if you can keep this for this time, the expiry date will be 3 months. So they can give that. Like parent to the direct teacher or the school nurse. So like that.
So, and then there's question, an extension of the question. She's asking, should it be a teacher or the school nurse? Because
This school nurse is very good. But you know, these seizures will have a duration of 2 minutes. The school nurse will come running and then the thing will stop automatically.
Right.
As it is, we see that when we try to bring that out, even at homes, people say that bar korte korte seizure theme jay. So that is the main thing. So school nurse can't always, I think, come. That's a practical issue, Mane, that will have to be faced.
No, thank you very much. The next question is about our dear Shreyan. He's an 11-year-old child, and I know Shreyan had been having seizures since he was 1.5, like he was 18 months old. And he's right now on 4 anti-epileptic drugs. So the mother wanted to know that, is there anything, because Shreyan he's non-verbal, but he's trying a lot to cope up. He has intellectual impairment with features of autism. I have been working with Shreyan for quite some time, and I know how well he's coming out of it. But the anti-epileptic drugs are there, but his mother wants to know that can there anything be done with this also to improve his cognition level, gross and fine motor skills?
Gross and fine motor skill, occupational therapy. Occupational therapy she is doing. There is no drug for motor skills other than this physiotherapy and occupational therapy. If anyone suggests so, it is not good. So there is only occupational therapy and physiotherapy for the motor skills. Then cognition. For cognition in the market, the pharmaceuticals have launched many things like Xenius Kid, there is Cognicare, there is Boost Brain, many things are there. And L-carnosine costs a bomb, like it's a small bottle and it costs 1,200. But again, those are experimental drugs.
I guess my question is because parents are very much bent upon these IQ enhancing drugs, omega-3 fatty acids and all. Okay, we understand the nutritive value of it, but parents are hooked up upon it because they feel whatever can be done for my child. Now, what is the think?
I think I'd like to ask the parents if parents are following any strict protocols, like name check protocols you have heard, like for autism, name check protocols. There are plenty of dietary protocols which uses many things like inulin. Okay, so inulin, omega-3 fatty acids, and many other things like almond milk. These are things, camel milk. These are things very in nowadays. Like many parents from like outside our state are asking, especially camel milk. Parents are importing those from Dubai and where not, and they are saying that people with autism who are having gut issues, because we know that autism is a gut-brain inflammatory disease or whatever, the new theories are coming up. So people who are having gut issues, they should try on these milk substitutes, which are coming up now. But for others, it will not show much benefit. Now coming to the cognition enhancers, like Cognicare and L-carnosine. They are saying that those are increasing the attention, but till now a child who is not having any kind of therapy, only on that medicine, there has been no trial because that is not ethically, that cannot be done. So it is not actually proven whether the child's cognition is improving by that medicine or the therapies. So it is not medically proven. If you want, you can give. Before giving medicines to the children, I myself take some medicines. I myself have taken this L-carnosine, the Cognicare medicines. I did not see any specific changes, but it did not cause any harm also. So I cannot actually comment because there has been no literature which can suggest that it is causing benefit 100%. But there is no medicine that causes 100% IQ enhancement.
Dr. Chaudhary, and since I address you by your name, hats off to you, Jashodhara. Not many physicians have this guts and this, intention to take the medicine themselves and try it, because these are going to be tried on my children. So
I could take and I can just tell the taste of each and every medicine the children take, because I myself take. Even one anti-epileptic I have taken. just to taste it.
Oh, that is really appreciated. Something that we should appreciate. And you know, a lot of parents are having the same question. Here is this Shorneem's mother asking that what are the side effects of the medicine? Because they all apprehend and they also know that somewhere down the line we have to take these medications, our children have to take it lifelong. So what are the side effects? Again, coming to the side effects, but you know, later on, because we parents of special needs children always come from the thing that what after us, then we don't even know whether
Exactly.
someone to give them the medications regularly like that. So then you know, what that do they need to be on these long term medications for a long time, or is it that you know there is something that can be done, and usually it happens, you get to see them graduating into their adulthood, and then what?
That depends upon the epilepsy diagnosis, what kind of epilepsy it is. Regarding the side effects, I'd like to say all medicines have side effects, and we have to read chapters on side effects of medicines. But particular few medicines I like to mention. If any person is having topiramate, Topamac, Topirol, anything that causes some weight loss, some renal stones. So any child having topiramate should drink plenty of water. If he has a decrease in stream of urine, so the parent should be very conscious, especially in a case of non-verbal child. Then there is Valpert, I have already mentioned. Then a parent is writing that carboxy. I think she is trying to say oxcarbamazepine. Carbamazepine. She is trying to say. So carbamazepine has one very important side effect that one person in 1 lakh has got a very bad type of allergic reaction called Steven-Johnson syndrome to carbamazepine. So if the child does not have that, then it is okay for the child. But if the child falls in that person becomes that person 1 in 1 lakh, the child is destined to have allergic reaction. So I think all doctors will mention that these drugs may have some allergic reaction. Levetiracetam, I already mentioned behavioral problems. Phenytoin is a drug that should not be given to girls because it causes some cosmetic problems, like there will be gum hypertrophy, teeth discoloring, this kind of things. And apart from that, some medications causes drowsiness, like clonazepam may cause drowsiness. And this Gardneril medicine, which we do not give above 2 years of age, that causes some cognitive decline. So these are the common things.
To the last question, and I think it's a very important question posted by I think Ayushi's mother had this question, that because you know we all also think of other than medications, but what would be the lifestyle of someone having seizures, and that would help them to reduce the seizures.
Yeah, lifestyle thing is that I'd like to first say that reduce the mobile watching, especially in dark environment and especially at after evening times, because what happens, it may trigger some seizures. Usually don't take them to cinema halls, because in dark, if there is loud sound and loud visuals, then it may trigger some kind of seizures, especially photosensitive ones. Again, don't if they're swimming, always it should be supervised, because if there is a seizure and the child is underwater, it may be very dangerous. Don't let them go near the fire, and those persons who are having seizures, it's preferable they should not drive cars or go in some ropeways or such those things, the crashing cars and those things that are seen in amusement parks, because that may be a dangerous ways, and the moonmakers, those can't be available. So these are the things. And night sleep is very important. Like if there is lack of sleep, it may trigger seizures. So that is an important thing.
Thank you very much, Jashodhara, Dr. Jashodhara Chaudhary, because it has been a very enriching session. And honestly, to tell you, because you can also relate more to us, as I said, that you have also been very close to people.
Yeah.
Having seizures. That makes a big difference in life. It makes a big difference. When I was a medical student, I read about Oliver Sacks' books on his. Doctors have read it, Oliver Sacks' books on different kinds of seizures people have, but then the wonderful abilities they have. So when
And another thing I'd like to say that many often there's a type of seizure that is seen in adolescents, the occipital lobe epilepsy, that is seen in they see hallucinations. So if the child is having this kind of thing, you should ask the child to draw whatever he's seeing. Okay, because those auras can be expressed by children, and that helps to differentiate between seizures. If it is black and white, if it's zigzag, it is rounded, so that may be helpful.
Yeah, even if they are asked to express themselves, I find one last question over here. Does taking Cognicare and Shizodone increase weight of a child? And
Yes, it may. Cognicare does not. I don't think so. But Seizodone may increase.
okay.
Mhm.
Okay, so it has been the very enriching session, and honestly,
Thank
to
you
tell
so
you,
much.
it has been the first session of Doctors Meet. I
Okay,
wish we
that's
got
so
you
good.
in person in our center or in one of our programs. We have a
Definitely.
little way of celebrating with our children. Maybe when days
Yeah,
get better, we can
definitely.
celebrate with you. And thank you very much. Thanks to all the
Thank you so much.
parents and the doctors who have joined today. It's been a very helpful session. Dr. Jayanta Rai could not join, but sir told me, please Joshudhara ke bola ami thakte parlam na, but I would listen to the YouTube video, and that's why he sent the message. And
Thank you so much.
hopefully in future we can start together. That will be
Yeah,
helpful.
definitely. So thank you so much.
Thank you.
And
We are
best
very
wishes
much
to
on
all.
time because, for these sessions, some of the other the people whom we are talking for, they are kept in other rooms. So that's why we
Yes,
are
definitely so. Definitely so. Yeah.
Otherwise, we could have continued hearing you, but thank you so much.
Yeah,
It's
thank you so much.
Thank you very much.
It
And
was lovely interacting with you.
yeah,
Goodbye.
share the YouTube. The YouTube link has also been shared, which is Bhavna Child Development Center's YouTube link has also been shared on Facebook, and we will again post it on Samya Foundation's YouTube link, so people can access it.
Thank you.
Thank you
Okay,
very
fine.
much to all our advisory board members also. Thank you. Thanks a lot, Dr. Vasuthara Chaudhary. Yeah, I would request Dr. Sudeshna Chaudhary, ma'am, if you could end the meeting.
Yeah. Okay, I'm ending the meeting. It's an excellent session, and it's so informative, and lots of doubts and lots of things has been cleared, and it's very wonderful session. Thank you, doctor. Thank you very much. Okay, I'm ending the meeting. Okay.